Hello dear students, today I will be continuing with the topic of epilepsy part 5, in which I will be telling you about clinical features and the various investigations which are required to be done to find out the cause as well as the treatment of epilepsy. I hope you will be enjoying the past videos, that is epilepsy 1, 2, 3. 4 will be uploaded soon, maybe tomorrow. So coming to the clinical features of epilepsy. Now first important part is usually the patient does not present during the episode of seizure or epilepsy. Why? Because usually it happens for a very few minutes, that means 1 to 2 minutes, and it may happen at any time while the patient is at home, while he is driving to school, or while he is in school, a child, or similarly he may be in his office. So the history of the patient, problem from the attendants is very important. So usually the patient comes during the post-ictal phase. Post-ictal phase means after the completion of the epileptic fit. इस पीरियड में पेशेंट के अटेंडेंट्स को लेके आते हैं कि भाई हमारे इस पेशेंट को इतने बजे ऐसे ऐसे करके फिट्स पड़े थे. So this is the first presentation by the attendants of the patient, and during that history taking we are to ask the patient complete history which they have seen, starting from the onset of the fit, that is by clenching of teeth or by tonic convulsions or spasm of the body, then clonic convulsions, and then any tongue bite, any injury on the face, on the body, and then incontinence of urine or feces. So this is the proper way of diagnosing epilepsy from the patient's attendance, complete history of the patient attack. Second type of presentation can be during the period of status epilepticus. So first is post-ictal, second is during period of status epilepticus. As I have given in my video on status epilepticus, this is defined as the condition of the body in which the patient is continuing to have recurrent convulsions for more than 2 minutes and without any period of break in between the convulsions or period of normalcy in between the convulsions. So this type of presentation is sometimes brought to us by the patient's attendants. Third can be epilepsia partialis continua. Epilepsia partialis continua. In this presentation, the patient may present with continuous convulsions of one part of the body. So that is epilepsia partialis continua. Fourth can be in patients of focal epilepsy, it can be Jacksonian march. Jacksonian march. What it means? That means the attack is starting from one point, that usually it is thumb, involving the hand, upper forearm, upper arm, and then face. So this type of presentation is Jacksonian march. So this type of presentation can be seen in certain individuals. Then fifth type of presentation can be in children. The parents of the child and the other attendants of the child come to the doctor with the history of absence seizures. What they tell, that the teacher of the child tells that sometimes while during the class the patient starts staring in the space. जैसे क्लास में बैठे बैठे ऐसे देखने लग जाएगा, as if he is not responding to anything. This is a sort of absence seizure or petit mal epilepsy. So this is because this seizure is seen in children, so the history is gathered from the teachers of the class of the student. So these are in short important points in clinical features or signs and symptoms. Then on physical examinations of the patient, when the patient comes to us, physical examination it comprises of general physical examination and systemic examination. Now in general physical examination, we are to rule out anemia, jaundice, cyanosis, pedal edema, raised jugular venous pressure, etc. So these conditions rule out systemic causes for epilepsy, like jaundice will rule out hepatic encephalopathy, then cyanosis will rule out pulmonary encephalopathy, similarly pedal edema for CKD, chronic kidney disease, etc. So first is general physical examination. It is to be done in each and every patient of medicine. Then systemic examination includes cardiovascular system, chest, abdomen, and nervous system examination. Now in nervous system examination, which is important in patients of epilepsy, we are to first nervous system examination. First is higher functions. Higher functions include consciousness levels, then speech, then orientation in time, space, and person. Orientation in time, space, and person. So these are higher functions. Then coming to the second part of nervous system examination is motor system examination. Motor system examination. This will include examination for upper motor neuron lesion, lower motor neuron lesion, and cerebellar system. Upper motor, lower motor, and then cerebellar. Then third is sensory system, and after this sensory system will include touch pain, and temperature. After general sensory system examination, then coming to the special sensory system. Special sensory system that include vision, hearing, gustatory, that means taste, etc. So these are important points in the physical examination of the patient. So from these two examinations, that is, first is history taking, detailed history taking, general history, specific history, then general physical examination, nervous system examination, we can reach at a diagnosis that this patient is having this type of epilepsy. Suppose it is a child who has come with the history of absence seizure, we can find out that this case is a case of petit mal epilepsy. If a person comes with tonic-clonic convulsions associated with prodromal symptoms or aura and postictal phase, along with tongue injury or tongue bite, injury to the body, incontinence of urine feces, then this can be a case of grand mal epilepsy. Similarly, a patient coming with one-sided problem like partial focal seizures, motor, sensory, psychomotor, or other temporal type of seizures, then from the history we can conclude that this is the type of epilepsy this patient is likely to be suffering from. So after this, the next step in the epilepsy is investigations. Now after concluding that the patient is having this type of epilepsy, we have to find out if we can any cause of epilepsy, that is through investigations. Next is investigations. Under investigations, we have to find out through the tests what can be the cause. So common important tests are, first is complete hemogram. Complete hemogram. That includes CBC, PBF, and abnormal cells. Second is blood examination for sugar. That will rule out diabetes. If it is positive, then get HbA1c done. That will indicate the proper control of diabetes. So HbA1c. Then second test in the blood examination is liver function test to rule out any evidence of hepatic encephalopathy. Then third test is RFT RFT, renal function test, that will include blood urea, serum creatinine, serum uric acid, serum calcium, and serum electrolytes like sodium and potassium. So these are the kidney function tests. Then after this we are to get the urine examination for ketone bodies to rule out diabetic ketoacidosis. Urine for ketones. Then next is X-ray skull to rule out neurocysticercosis, which may be a calcified lesion and calcified granuloma. Then we may also get neuroimaging tests like CT scan of the brain and MRI of the brain. So these two are neuroimaging tests. So after getting all these battery of tests done, and then we can make the diagnosis on the basis of number 1 history, number 2 physical examination, number 3 investigations, and then very important investigation which is done after reaching at a diagnosis of probable epilepsy is EEG, electroencephalogram. Now this is the electrical response of the brain, which is being recorded by the apparatus showing abnormal impulses arising from the different areas of the brain. So this is EEG. So on this basis we reach at a diagnosis of epilepsy. So after diagnosing epilepsy, the next process is how to treat the patient of epilepsy. So today I will conclude here only. Next slide or next video I will show, or I will talk about the management of epilepsy, which is very important from the point of view of general medicine as well as your examination point of view. So I hope you must be enjoying the videos. You are requested to download my app, that is Dr. Ashok Kumar Rana, and from that app you subscribe to my channel, to subscribe to my app, and go on reading various topics in the courses for BDS students. So any comments, any queries you can write on the video page, and try to subscribe and bell the icon. Thank you.